Welcome back to our channel where we dive into the latest health and wellness trends to help you live a longer, healthier life. Today, we have some exciting news to share about a groundbreaking study on nicotinamide riboside, or NR for short. We're going to explore how NR can protect against liver damage and improve metabolic health, making it a potential game changer in the world of supplements. Make sure to check out the link to the research findings in the description below. Published on March 22, 2024, this study highlights the effectiveness of NR compared to other NAD+ precursors like nicotinic acid, Na, niacinamide, Nm, and nicotinamide mononucleotide, NMN, in alleviating high-glucose-induced liver injury. The research used a fish model to mimic hyperglycemia-induced liver damage. Here is how the study was conducted and what makes NR stand out. The researchers established an in vitro high-glucose model to simulate liver damage, marked by reduced cell viability, increased transaminase activity, and depleted NAD+ concentration. The fish hepatocytes were treated with the 4 different NAD+ precursors to evaluate their effectiveness. The study assessed various parameters: how well the cells survived after treatment, used as a marker for liver damage, determining the NAD+ boosting capacity, evaluating SIRT13 activation, which is crucial for anti-aging and metabolic regulation, analyzing the effects on oxidative stress and inflammation levels, observing impacts on glucose transportation, glycolysis, glycogen synthesis, the pentose phosphate pathway, and gluconeogenesis. An additional oral gavage test confirmed the effectiveness of the precursors in increasing hepatic NAD+ content and the NAD+NADH ratio in vivo. Now let's look at the key findings of the study. NR significantly improved cell viability. NR had the most potent effect in boosting NAD+ levels. NR significantly activated SIRT13, enhancing its anti-aging and metabolic regulation benefits. NR was superior in reducing oxidative stress and inflammation compared to Na, Nm, and NMN. NR was more effective in preventing cell apoptosis. While apoptosis is a natural and beneficial process critical for health, balance is key. Both excessive and inadequate apoptosis can lead to health problems. In the context of this study, preventing excessive apoptosis in liver cells under stress is beneficial, as it helps maintain liver function and health. NR improved glucose transportation, glycolysis, glycogen synthesis, and the pentose phosphate pathway while inhibiting gluconeogenesis. The oral gavage test confirmed NR's potent effect in increasing hepatic plus content and the NAD+NADH ratio. What are the implications of this study for people with metabolic disorders such as diabetes? The study's findings suggest that nicotinamide riboside, or NR, could be particularly beneficial for individuals with metabolic disorders, including diabetes. Here's how. Improved glucose metabolism. NR was shown to enhance glucose transportation, glycolysis, glycogen synthesis, and the pentose phosphate pathway. It also inhibited gluconeogenesis. This means NR can help regulate blood sugar levels more effectively, which is crucial for managing diabetes. Reduction of oxidative stress and inflammation. NR demonstrated superior effects in reducing oxidative stress and inflammation, which are common issues in metabolic disorders like diabetes. By mitigating these factors, NR may help reduce complications associated with diabetes. Protection against liver damage. Diabetes often leads to liver-related issues such as non-alcoholic fatty liver disease, or NAFLD. NR's ability to protect against high-glucose-induced liver damage suggests it could be beneficial in preventing or alleviating liver complications in diabetic patients. Enhanced NAD+ levels and sirtuin activation. The study found that NR was most effective in boosting NAD+ levels and activating SIRT13. This activation is associated with improved metabolic regulation and insulin sensitivity, which are critical for diabetes management. Overall, incorporating NR as a supplement could offer a promising approach to improve metabolic health and manage diabetes more effectively. Are there any dietary sources of NR, or is supplementation necessary to achieve these benefits? Nicotinamide riboside, or NR, is found in trace amounts in certain foods, but these amounts are typically too small to have a significant impact on NAD+ levels and confer the benefits observed in studies. Foods that contain small amounts of NR include milk, Dairy products, particularly milk, contain NR, but the levels are quite low. Fish. Some types of fish have trace amounts of NR. Yeast, nutritional yeast and yeast-containing products may also provide some NR. However, to achieve the benefits highlighted in the study, such as significant boosts in NAD+ levels and protection against metabolic disorders, supplementation is generally necessary. NR supplements are specifically formulated to provide higher, more effective doses of NR that are unlikely to be obtained through diet alone. Please see the description below for a good source of NR supplements. Are there any known side effects or risks associated with taking NR supplements? Nicotinamide riboside, or NR, is generally considered safe for most people when taken at recommended dosages. Dosing of nicotinamide riboside ranges from 100 mg a day to 2,000 mg a day, with no major adverse events reported in most studies. However, as with any supplement, there are potential side effects and risks to be aware of. Mild side effects. Some individuals may experience mild side effects such as nausea, fatigue, headaches, indigestion, or mild gastrointestinal discomfort. Allergic reactions. Although rare, some people might have allergic reactions to NR supplements, which could manifest as skin rashes or itching. Unknown long-term effects. While short-term studies suggest that NR is safe, the long-term effects of prolonged use are not yet fully understood. More research is needed to determine the safety of long-term supplementation. Interactions with medications. NR may interact with certain medications. For example, it could potentially affect the efficacy of chemotherapy drugs. It's important to consult with a healthcare provider before starting NR supplements, especially if you are taking other medications or have underlying health conditions. High dosages. Taking excessively high doses of NR supplements may increase the risk of side effects. It's important to follow the recommended dosage guidelines provided by the supplement manufacturer or your healthcare provider. Overall, while NR supplements are generally safe for most individuals, it's always best to consult with a healthcare professional before adding any new supplement to your regimen. In conclusion, the study conclusively demonstrated that nicotinamide riboside, or NR, is the most effective NAD+ precursor in protecting against high-glucose-induced liver injury and improving metabolic health in the fish model. This positions NR as a promising supplement for enhancing liver health and combating metabolic disorders. If you're looking to protect your liver and boost your overall metabolic function, NR could be a great addition to your supplement regimen. Thank you for watching. Don't forget to like, subscribe, and hit the bell icon to stay updated with the latest in health and wellness. And be sure to check the description below for a link to the full research findings. Stay healthy and see you next time.